Hello everyone, today group will present about introduction health science. In group we'll have Tina, Steven, Alex, and me, Pepsi, and Brian. First we will about question about health science. Question 1. What were your initial thoughts about health science? Question 2. What are some career opportunities in health science? Question 3. What are some educational pathways for people to get involved in this field? Question 4. Does health science only refer to medical science and pharmacy, or is a much broader discipline that involve other subjects of fields such as social science and humanities? What are some other fields and topics that are related to the health science? Question 5. After watching the videos, class discussions, and doing further research, come up to a definition or description for health science. Now we will begin with question 1. What was what grade your entire thoughts on health science? Usually people will think health science related to medicine and pharmacy, and it has to improve human health and create resistant drugs. Moreover, health science is subject related to biology and chemistry. In the society, we see the doctor or the nurse will relate to the health science, or some physicians will be give advice for you to improve your health.
So we move to the question number 2. The question number 2 is, what are some career opportunity in health science? The first job is medical assistant. The medical assistant are healthcare professionals who assist doctors in clinics and medical office. So they will ask about the symptoms and health concerns and pass the information onto the doctor. And next is the medical secretary. So medical secretary provide the administrative and secretarial support to hospital doctors, health service workers, and medical research. Lab technicians. So lab technicians in who perform the practical hands-on work in laboratories, and their duty includes setting laboratory for scientific research, conducting lab-based experiment, recording and analyzing research. And the third job is health educator. Health educators work to encourage healthy lifestyle and wellness through educating individuals and communities about behaviors that can prevent disease, injuries, and other health problems. And finally, the final job is doctor. So, doctor is someone who is experienced and certified to practice medicine to help maintain or restore physical and mental health.
So let's move on to the question 3. What is some education pathway? I gave with the answers you can learn in the School of Medicine, such as the University of Queensland. And after you graduate from your school, you will be carried deep into the expressive and research.
So now is question 4. Does health science only refer to medical science and pharmacy, or is it a much broader discipline that involves other subjects, fields such as social sciences and humanities? What are some other fields and topics that are related to health science? So we got 3 other fields such as hearing aid specialists, mental health counselor, and register dietitian. So hearing aid specialist, also known as a hearing instrument specialist, is a professional who evaluates people with hearing problems and chooses the best hearing aid to improve their condition. Hearing loss is frequently encountered among the elderly, but also in younger people. And next is mental health counselor, and people who working in that field, they often have a licensed professionals, so they treat the cognitive, behavior, and emotional aspects of mental health and substance use conditions. They work with individuals, families, couples, and groups in a variety of settings. And the last one is register dietitian, is people who do scientific research and advise others on nutrition and health issues. In other words, the nutritionist will monitor and evaluate the nutritional status of patients being treated in hospitals and nutrition centers to plan appropriate interventions.
I move on to my question 5. After watching the videos, class discussion, and doing further research, come up with a definition description for health science. First of all, I thought about health science that is not only the people who learn it, who can learn in the field, where researchers who have nutritious diets and a healthy way of life study. And the benefiting of learning health sciences is that from the scientific point of view, you can understand how lifestyle-related lifestyles such as the diet and exercise affects our health, and also our own health. You can take care of this since you are young, and that means health science is the this keep line of applied science which deal with human and animal health. There are two parts to health science: is the study, research, and knowledge of health, and the application of that knowledge to improve health, cure diseases, and understanding how human and animal function. And next one, we move on to my topic, and here we talk about the public health definition and key term, history of public health and public health approach, core function and essential services of public health, stakeholder role in public health, determining and influencing the public health. Next. The topic 1, introduction to public health. Definition of public health: the health of the population as a whole, especially as the subject of the government regulation. It means that the science and arts of preventing disease, prolonging life and promoting health through the organized efforts and informed choices of society, organization, public and private communities, and individuals. Next one, we move on to the mission of the public health. Public health care also aims to provide maximum benefit for the largest number of people, fulfilling society interest in assuring conditions in which people can be healthy. And the mission of the public health that preventing, promote, repair, and preventing. And the mission is disease injury disability disability and promote health and well-being, prepare for a response to disaster. And next one, we move on to the public health key term. And the clinical care is preventing, treatment, and management of illness and the preservation of the mental and physical well-being through the services offered by medical and allied health profession, also known as health. Next one is the determinal factor that contribute to the generation of a trait and epidemic or outbreak occurrence in communities or region of cases of illness specific health related to behavior or other health related eventuality in excess or on of normal expectancy. Post-term are used interchangeably. However, epidemic usually refer to the largest geographic distribution of illness or health-related event. And next one is health outcome. Health outcome is a result of a medical condition that directly affects the length or quality of person's life.
Okay, now we come to topic 2 about the history of the public health. So now let's review some highlights events from the throughout history of the public health. In public health, we have 4 lenses: sanitation and environmental health, pandemic, disaster response and preparedness, and the last one is prevention health policy. So now let's talk about the first one is sanitation and environmental health, which is control of disease and promotion of health through sanitation to ensure a healthy environment. So we have the example around 500 BCE is 2,500 years ago. They have recorded that the ancient Greeks and Romans, they have practiced community sanitation measures and until 1840 century. We also can see that the work began long ago in Britain, continue in UK, also called United Kingdom. Towards the passion of the public health act of 1848, which is established a central block of Health and placed responsibility for the sanitation in the hands of Peros. In 1970, in the U.S., also called United States, the administration of the President Nixon established the Environmental Protection Agency, which still today they still protect our life by safeguarding air, water, and lands. So let's move on to the second lens. The second lens is about the pandemic. It's similar to epidemic, but it's expect they are effort even larger and of the populations across countries and also the continents. Like influence, like the influence is also called the flu, has caused pandemic many times during both the past and the past that long ago and in recent history. The centuries ago, the Spanish flu infected 500 million people around the world, including in remote Pacific Island and the Arctic. It kills between 20 to 50 million people. In 2009, infected people in 214 countries, causing almost 19,000 deaths, but it's still many deaths. But we can compare it to 100 years ago with the Spanish flu. So we can see that we are having made the tremendous stride in public health in terms of the controlling influence. And next is polio was a common and highly fatal disease that caused severe illness, including paralysis and even death. 1,000 of people lie up to there are almost 1,000 of people lie up to resist a polio vaccine when it was introduced in 1955. An initiative to eradicate polio was launched in 1988, with third efforts decreased the rate out from 125 countries to a few countries. Now we move on to the third areas was the public health role in preparedness and disaster response. Example that we have the example that the use of the biological warfare to infect people and animals go bad. One of the earliest account is the use of plague as the weapon of war during the siege of Kaffa in 14th century AD. The public health community is prepared to distribute life-saving pharmaceuticals in articles, medical supply, and equipment to locations across the country and even around the world. We have the attack in the United States on September 11, 2001. The public health workers was on the route of the World Trade Center and at the Pentagon to conduct surveillance to identify outbreak of disease and have control and have conditions that might have results from the attack. Also, the response of the natural disaster after Hurricane Katrina hit in 2005, the public health worker choice into the disaster relief agencies to provide emergency service and dispatch team to conduct surveillance for illness and injuries among residents in their home to location of shelter. the last part, the last thing is about the health policy as the means of prevention. They implement a range of policies across areas of public health to support efforts on societal level. For example, in 1500 BCE, the Leviticus is one of the first book of Hebrew Bible, addressed personal and community responsibility and including guidance about bodily cleanliness, sexual health behaviors, and protection against contagious disease, including that isolates the people with the leprosy. We have the law banning smoker. That they ban the smoker in the workplace, restaurants, and other public places have now been passed to encourage smoker to quit. Also, increase in cigarette taxes. So let's move on to the last part of the. Let's move on to the last part. It's about the opportunities. It's near. In the past, we have nearly 60 million Americans, including 1/3 of adults and about 1/5 of children who are observed. Doctors usually define the obesity as the condition in which a person's wealth is 20% or more above normal wealth, or as the body mass index measurement of 30 or more. The policy and laws related to food labeling, Ministry of Physical Education and resource for the children in schools, and even address to healthy food and safe place to be physically active in the community. So now, to summarize for all of the topic two, we will have public health work to prevent epidemic and the spread of disease and injuries, to protect against environment hazards and promote accurate healthy behavior, support to disaster and outbreak.
So the next topic is a public health approach. So the first term is surveillance. So which is used to monitor public health situation. The next one is epidemiology, which is enable us to determine where diseases originate, how and why they spread, and how to prevent them. Public health is very important in supporting public health by performing tests to confirm disease diagnosis. And laboratory also support public health by conducting research and training that is valuable to the field. And the last one is informative. To move from the use of paper documents more to electronic health records due with the method for collecting, compiling, and presenting health information.
We turn to the topic 4, which is the core functions and essential services of public health. So, as you can see, the graph is on the right hand side. On the graph show you about the three core functions of public health agencies was defined by the Institute of Medicine in 1988. So the first core functions is assessment. So assessment means knowing what needs to be done, and it's based on the collection and analysis of data. And the second And the second part is a policy development. So the policy development is much broader than the legislation for once it can be used standard operating procedure laws, and it's beyond the information that's come from the assessment functions. And last one is assurance. Assurance means ensuring that policy and program are received and implemented by providing public health services to those who need them. Next, please. So I want to talk about the 10 essential functions. So as you can see the graph, the 3 core functions are on the outside of the circle, and the 10 essential public health are underneath these 3 core functions. And so under the first core functions is assessment. The monitor health to identify and solve the community environmental health problems. Essential number 2 is diagnose and investigate environmental health problems and health hazards in the community. And under the policy development, so we have inform, educate, and empower people about environmental health issues. Number 4 is mobilize communities, partnerships, and action to identify and solve environmental health problems. And the essential service number 5 is develop policy and plans that support individual and community environmental health efforts. And the last conference and under the last conferences, we have enforce laws and regulations that protect environmental health and ensure safety. And number 7 is link people to need environmental health services and ensure the provision of environmental health services when otherwise unavailable. And number 8, ensure the competent environmental health workforce. Number 9 is evaluate effectiveness, accessibility, and quality of personal and population-based environmental health services. And the last one, research for new insights and innovative solutions to environmental health problems. Line. Sao cái kỳ vậy?
Next, we will read topic 5. Determining and influencing the public health. For example, transportation, housing, school, city planning, law enforcement, and faith-based intentions. Partner in public health system. 1 is community, 2 government public health infrastructure. 3 is academy, 4 is media, 5 is and 5 is clinical care delivery system, and finally is 6 employees business. And other partner academia include education, training, research, and public service. Second is government includes city planning, education, and health in armed policy. Third is media, health, education, and promotion. Health and communication and social media and cultural. And finally, is employees and business. Employees include employers sponsor health insurance programs, wellness integrity and benefit salary is healthy workplace and community. And finally, topic is stockholders' role in public health. First is health determined gender biology, health behaviors, social and societal characteristics, and health supply or medical care. Second is health impact pyramid. You can see in the picture, health impact pyramids include increasing public health impact and increasing individual effect needed. The pyramid illustrates the impact of different types of public health intervention and implementing intervention of all levels of pyramid. We are going to achieve the maximum possible certain public health benefits. And next is the thought we use it in the question and topic. Thank you for watching.